We go to our next story. I'm keen to make sure we give time to our next guest. His name is Dr. Onkar Sahota, Labour Party politician, but also an NHS GP. Hello there, Doctor. How are you?
Hi, I'm fine, thank you.
Well, first of all, thank you so much for joining us today. Look, obviously, the big news here is about the junior doctor strike that's been continuing. And quite remarkably, we found out that about 95% of the NHS operation, as it were, is continuing as normal. And it seems that many junior doctors are not necessarily on the picket lines as has been historically. Do you think the BMA has overreached here?
I think the BMA is a trade union and is responding to the membership. I know from first hand that it's working safely because my own granddaughter was admitted to hospital over the weekend, and she felt I felt very safe, and the doctors were there. So I think no one's lives were being put at risk. I think people's operating lists may have gone up, right? And which is significant, but I don't think anyone's lives is at risk, right? So doctors have been responsible. But the other important thing is that rather than being involved in a media warfare, the Secretary of State for Health and the doctors and the BMA should sit down across the table and sort out. It's not just about money, it's about working conditions, about training and the issues, right? And I think to just simplify this about money isn't good enough.
I saw one stat which shocked me, which is resident doctors make about half the medical workforce in the NHS, which I wasn't quite aware, I don't know why, of how large that is. And obviously have up to 8 years experience working in a hospital doctor or 3 years as a GP general practitioner. I mean, Wes Streeting, as you say, has accused those striking of, quote, inflicting pain and misery on patients, and basically has inferred, obviously, patients being held to ransom. Do you think Wes Streeting has been unhelpful in adopting what he probably would have attacked the Conservative government previously of using unhelpful rhetoric? And when, as you say, this is about just trying to have a common sense conversation.
I think that those are very emotive terms, and I wouldn't use them. For example, this is a group of people who've gone to medical school, and when they went to medical school, they were asked, why do you want to do medicine? And the reason they said, we're interested in science, we want to work with people. I don't believe that any doctor is in the job of medicine in order to inflict pain. These are very emotive terms and not very helpful in negotiation. What you really need to say is, look, what are the issues here? What can we do? And be honest and sincere in those negotiations. And I think doctors have a role to do that also, by the way. But I think there's no doctor around here who wants to inflict pain or suffering on their patients. They are frustrated by the system, and this is ultimately about retaining doctors in the healthcare system so we can have a healthcare system which the people can be proud of.
Out of interest, so there will be people who would say that your doctors are being greedy, junior doctors that is. They already had the 28.9% pay increase award. They're now calling for another 26% on top of the 28.9%. This is just about money. This is all about greed, and it's unaffordable, and doctors should realise the economy is in a difficult situation. You've had record investment in a one-off, £25 billion increase in NHS funding. That shouldn't just go on wages. It should be going on increased technology, new equipment, new medicines that can make a big difference. What would you say to people, probably a lot of our listeners, who would criticise doctors for basically thinking about themselves rather than their patients?
Well, look, we need to put it in context. The doctors have been on a 6-year university course rather than a 3-year one. They leave with bigger loans than other students, other graduates. Secondly, that their pay salaries may not just in terms of basic salary, but it's also the number of hours they do, the out-of-on-call hours, the additional hours. And it is about retaining doctors. How many doctors are leaving the NHS? And also the United Kingdom is in an international market force. Australia, Canada, and those countries offer a much better working condition. I think ultimately it isn't about money, it's about working conditions also. When doctors have done 2 years training, there are 10,000 of them applying, 30,000 of them applying for 10,000 jobs. So there's not enough training jobs, there's not enough opportunities for them. And look, we need these doctors to be happy. We can't regulate them just through money. We need to regulate them through working conditions, and also making sure they choose to work in this country rather than going overseas. And then one other thing is that we rely upon doctors coming over from overseas to maintain our NHS. Since 1948, we have been net importer of doctors and nurses from other parts of the world. Why is that?
Well, I was interested you raised that, because I was keen to ask you, if I may. Obviously, we've heard some extremely tough rhetoric from the Home Secretary, Shabana Mahmood, yesterday when it comes to illegal migration. And there is even today a Telegraph reporting that if migrants who have lived here have children who are born here, even those children could be deported along with their parents. Are you deeply concerned and troubled as someone who is a Labour Party supporter about the rhetoric being used by the Home Secretary? Do you think it is adopting the language of reform of the Conservatives? You know, the fact that even Tommy Robinson was praising what Shabana Mahmood announced yesterday, does that make you feel uncomfortable?
It makes me very uncomfortable, and it makes me very uncomfortable in the sense that I came to this country, my father came to this country, I went to medical school here and have contributed. I think Mr. Hamza, the chairman of the reform group, his father was doctor also. The Rishi Sunak, right? His mother and father were healthcare system. So we've all come and worked here, okay? And I think we need to make ourselves that if you work in this country, you contribute to the country, you feel safe here. And the whole thing about, I think, where we've gone wrong is that we should be talking about integration, and people who come here should be welcome. And we all need to make an effort of integration. Even people who've settled this country from overseas should say, look, we've come to make England our country, our kingdom our country. Let's integrate here. And I think we got something wrong in our multicultural system, and which is a debate for a different thing. But I think it is about making people welcome who are contributing to society, and that they are equal in society rather than two-tier society. That would be disastrous for us.
Would you like to see Shabana Mahmood dial down some of the rhetoric, maybe even apologise for some of the things that she said, and see a rethink on plans around both illegal and legal migration? Or do you accept that she has to stick the course if Labour's going to have any chance of winning the next election?
I think we all need to tone down, that we need to talk about this thing in a very responsible way, and not make the country unwelcome or create the environment, right, where people feel unsafe or become unwelcome. I mean, look, we all need to tone this down and take out the threatening nature of the conversation which we have in place at the moment.
Do you think it will have the rhetoric that's being used at the moment? Do you think, or is it indeed even having an impact on NHS recruitment from what you can see already?
Of course, I think we already are seeing that. People aren't choosing to come to this country. They'd rather go to Australia, Canada, America, where they have bigger pay salary and also better weather and better working conditions. We as a country have the lowest number of doctors and nurses to the population compared to most European countries. We don't look after our workforce in the NHS. And I think on the NHS generally, I would say that we need to have an honest debate with the people of this country of what the NHS is about, what are we expecting from the NHS, and how do we deliver it. And any government who does that will be a brave government, because people don't want to have that conversation, but we need to be brave about it and have a conversation. What the NHS is about, and where does the line between healthcare and social services is drawn. We've got it all wrong, and I think we need to sort this out.
Dr. Onkar Sahota, thank you so much for joining us here on Talk today.